The COVID-19 pandemic brought many changes to the city, and one of them was hiring the city's first public health advisor, Nicole Dupuis-Witt.
Having that position means that we have access to a professional that understands public health, the role of public health, communicable diseases, as well as what the impacts of heat and the other things that we have in our environment have on our unsheltered population and our other residents that we serve on a daily basis.
Spent a lot of time advising and working with municipalities and cities on various health initiatives and health projects, from everything from opioid crisis to COVID, of course, maternal and child health, food access, you name it. I've been part of it as part of my career in public health.
Prior to her role at the City of Phoenix, she served as Chief Executive Officer for a local public health unit for a city of around 500,000 people.
We had a large public health workforce of doctors, dentists, nurses, nutritionists, public health educators, over 300, and certainly swelled during the pandemic like every public health unit and public health department did. Through that role was providing with our medical officer of health the leadership to the city and our plans and strategies for COVID-19, and then certainly the plans and strategies towards recovery. I think what attracted me to the job is that it's unique. There aren't that many large cities that have a public health office that don't have a public health department. And so I was intrigued by the opportunity to work alongside municipal colleagues in a different way than I had, working in a public health department. And the city's already doing amazing things for public health.
When asked about goal settings for the year, she said,
as far as my goals go, my goal would be to learn more about the city, look at data, statistics, work with the health department, determine what are their key goals. I know that there is a community health assessment that's done every 3 years by the public health department, and actually we're in perfect timing for that to be renewed.
This is a unique city position, but Nicole is up for the challenge.
The environment that we live in, the streets are, do influence our health. They influence the choices that we have access to. They influence our overall well-being. They influence our mental health. So I think, it's just exciting to be part of the city that has so much opportunity to shape and influence, the health of the residents. And so, hope to be a part of setting that in the right direction and continuing to support the great work that's already happening.
For Phoenix TV, I'm Deborah Cedillo Dugan.